in particular healing heart disease. It's one of the most amazing miracles of our century is that we are actually able to reverse heart disease with some very healthy, natural ways. So we're going to actually look at that in a bit more detail soon. But essentially, we know that heart disease, cardiovascular disease, this is probably the #1 killer, or at least certainly at the top there. And all of this, or the vast majority of it, is really to do with our lifestyle choices and the stressful lives we lead, really. They're the major contributors. So let's have a look at this in a bit more detail. So the major risk factors, we've got smoking. Most of us would understand that one. High cholesterol and other bad blood fats, such as triglycerides. High blood pressure, being overweight or obese, having high blood sugars or diabetes, an unhealthy diet, not getting enough exercise, drinking too much alcohol, and there's a whole host of what we call psychosocial factors. That's your stress, mental illness, isolation, addiction, all these things also contribute. Now, one of the most amazing things I have learned in terms of understanding the heart in this field of medicine is that the heart has its own mini brain. It's called the intracardiac nervous system, and for many years we have known that emotions such as love or fear, for example, leads to changes in our heart rate, our blood pressure and breathing, just examples. But we always thought that was just due to our nervous system responding in concert with the brain. However, research in the last few decades has found that the heart has its own functional mini brain. It has the following features. It has several different types of neurons or nerve cells, neurotransmitters, supporting cells and proteins similar to those to the brain that is up on top. It operates and processes information independently of our great brain or the rest of the nervous system. It even has its own simple logic and thought. It can send messages to our head brain, including to the higher centers at the frontal lobe. The head brain understands our heart brain so definitively that it can obey those messages from the heart. It can influence our perceptions, our mental clarity, creativity, decision making, and many other cognitive processes. The greater the coherence in the heart rhythm patterns, the more positive the effects. So how does it communicate? Well, the heart brain has the most powerful and extensive electromagnetic field in the entire body, with the magnetic component being 500 times stronger than the head brain. The heart's electromagnetic field is so strong you can actually detect it a couple of meters away from the body. It is thought that this is the means that the heart uses to communicate with the brain and indeed the rest of the body as well. It is so powerful, now here's an interesting thought, talking about intuition here, that they've even discovered that one person's heart can synchronize with another person's mind. So how amazing is that? And the reason that I looked into this is because when I was working in some coronary care situations, I found that there was a particular issue with depression after people who had heart attacks. You might go, well, that's understandable, they just had a major event. But I didn't see it when I was looking at people who were diagnosed with cancer or other major life stressful medical events. It really was particular to people who had heart attacks. So clearly there was some sort of damage happening here that was synchronizing with the brain. And so that's how they've actually sort of looked more into this and they've discovered all these things. But even though we found this out in science, I think most of us have always known there was something very special about our hearts, as all the good literature tells us long before the science caught up. On that note, it's going to give a whole new meaning to a couple of verses from the Bible that I'm going to share with you. This is a Psalm of David, Psalm 51 verse 10. It says, "Create in me a clean heart, O God, and renew a steadfast spirit within me." So if you are embarking on a journey to clean up the health of your heart, adopt this verse and ask God for a clean heart, which will renew a right spirit, a right mindset within you. And this one as well. Solomon, the wisest man that's ever been recorded to live, penned these words, which also suddenly have a much deeper meaning now that we understand this amazing complexity of the heart. Proverbs 4 verse 23. "Above all else, guard your heart, for it is the wellspring of your life." So how important is it that we value our hearts and look after them now that we know all this? So without further ado, we're going to move into some of those lifestyle changes that are absolutely essential to both prevent and, of course, potentially stop the progression of the heart disease. Now, before we address any of the others in restoring your heart health, let's have a look at smoking. So even if you're not a smoker, by the way, take some notes from this. You don't have to literally take it, you go to my website, and have a look at some of the amazing things that can happen. But we know that it causes at least 20,000 deaths each year in Australia alone, just from smoking, more than 5 million deaths worldwide. Smoking cigarettes will expose you to about 70 toxic carcinogens that cause more than 40 different types of cancer. Nicotine itself, despite what people think about nicotine, but nicotine itself also destabilizes the heart rhythm. So if you do have a heart attack and you're a smoker, you're more likely to die from a fatal heart rhythm complication thereafter. The carbon monoxide exposure from smoking causes damage to the lining of your arteries, making it easier for blockages to form and atherosclerosis that leads to heart attacks and strokes. The benefits to quitting are immense, and the body has an amazing way of recovering. Let's see what happens. Almost immediately, you'll improve your heart rate and blood pressure. Within a day, the levels of poisonous carbon monoxide in the blood drop to normal, preventing further damage to the lining of the arteries. Over the next few months, you'll improve the circulation throughout the body and the lung function will start to increase. Over the next several months, the lungs continue to heal and the coughing and shortness of breath really decreases. At the 1 year mark, your risk of heart disease is half that of someone who's still smoking. At 5 years, your risk of a variety of cancers, mouth, esophagus, throat and bladder, for example, is halved, and your risk of stroke is that of a non-smoker. Now at 10 years, your risk of lung cancer is half that of a smoker, and at 15 years, your risk of coronary artery disease is that of a non-smoker. So my message here is that it's never too late to stop smoking. You will get immediate benefits and then it will continue from there. Now, most of us do know that a really healthy lifestyle will be fantastic at preventing cardiovascular disease and many other health problems, but can we actually reverse heart disease? The answer is absolutely, and we have really strong evidence now to back this one up. For decades now, a doctor by the name of Dr. Ornish, he was an American cardiologist, he's also a researcher, and along with his team, he has been studying the effects of lifestyle changes on heart disease, cardiovascular disease, and more recently he's actually looked at things such as cancer and dementia and getting the same results. So he took a group of people who had proven coronary artery disease from actual angiogram evidence. So this is pictures where they've looked at the blood vessels and they've seen blockages there. He then decided to put them on a very comprehensive lifestyle program, and at the same time there was another group that we call the control group that didn't have the same intervention. So there was a really good comparison, and let's look what that lifestyle program was. So the diet, it contained all of your whole grains, your fruits, your vegetables, legumes, but they avoided processed foods and animal products. And by the way, all forms of free oil as well. There was no caffeine, very limited alcohol, but there was no calorie restriction at all. Definitely had some stress management techniques put in there, or at least 1 hour a day of something to help manage their stress. He made sure they had good emotional and social supports, and they exercised for half an hour a day. So, what happened in the study? Well, not surprisingly, the group that had no lifestyle intervention had worsening heart disease and increasing blockages in their hearts. The group that was treated, even at 1 year, showed significant improvements already with actual reversal of their blockages starting to show. As they were followed over the next few years, the untreated group would continue to worsen, but the treated group went from strength to strength. Not only did the blockages continue to improve, there was a 300% improvement in the blood flow to their hearts. they were literally reversing their heart disease. So he summarised it at the end. He said, we need to eat better, move more, stress less, stay connected with others. And we're going to break that down a little bit more with a bit more detail than his summary. So, now, it's pretty descriptive there, isn't it, that picture? This plant-based diet is the only one that has been shown to not only prevent, but also reverse heart disease. And we're going to explain this in a little bit more detail for you. Now, we know that high blood sugar and diabetes is a major risk factor for heart disease. The Diabetes Prevention Program trial showed that an lacto-ovo-vegetarian, these are vegetarians that still eat eggs and dairy, they reduce their risk of developing diabetes by 60%. However, going completely plant-based and removing all animal products led to an almost 80% drop in the risk of developing diabetes. In fact, this study demonstrated that lifestyle modifications were almost twice as effective as leading treatment with leading diabetic medications. So that's considerable benefit just with lifestyle. So what about blood pressure? Well, research has shown that the more plant-based your diet is, the greater the drop in your blood pressure. Vegans, or those who don't eat any animal products, on average have lower blood pressures than lacto-ovo-vegetarians who are still eating dairy and eggs. And meat eaters have the highest rates of elevated blood pressure and use of blood pressure medications. So even in the first 2 weeks of being on a whole food, plant-based diet, blood pressure can show some very significant improvements just in 2 weeks. Then there's the cholesterol story and other bad blood fats that increase your risk of cardiovascular disease. It does improve these as well. So T. Colin Campbell, which we spoke about yesterday, who wrote the China study and looked at the cancer risk associated with animal products. He also looked at a comparison of the diet in rural China to those in the United States. The Americans had twice the fat, 10 times the meat consumption, and only 1/3 of the fibre compared to those in the Chinese diet. The cholesterol readings were almost 40% higher in the US compared to China, but what the numbers were really astounding was the deaths from coronary artery disease. US men were more than 16 times, and US women more than 5 times likely to die from cardiovascular disease. So in many non-Western civilizations where the diets are predominantly plant-based and low in fat, coronary artery disease is almost non-existent. Now, on average, a lacto-ovo-vegetarian who's still eating dairy and eggs will have a cholesterol almost 20% lower, 20% lower than a meat eater, but a completely plant-based person will have a cholesterol about 40% lower. So it does make a huge difference there. And we know also that whole food plant-based diet is usually quite rich in fibre, and high fibre has also been shown to reduce cholesterol very effectively, almost as effectively as statin medications as well. So another interesting fact related to cholesterol, however, even if you remove all the fat from the animal product, whether it be meat or dairy or anything like that, animal protein alone increases your cholesterol. So that's another incentive to try and remove as much as possible the animal products from your diet. Now, the benefits of the whole food plant-based diet continue. We also know that the greater the proportion of plant-based foods consumed, the more likely you are to have a healthy body weight. Again, this will reduce your risk of cardiovascular disease. So that's a bit of a breakdown on the benefits of that plant-based diet on your heart health. Now, garlic always appears in my talks, again, because it's got so many different benefits, but in particular, the foods that provide the most cardiovascular benefits, I'm just going to give you a few at the moment. So the allium family, which includes the onions and garlics, have really been shown to help in this sphere. So we know that it helps to prevent atherosclerosis, or the build-up of fats in the blood vessel. We know that it can reduce your blood fat levels overall. We know that it can help to lower blood pressure, and it also helps to thin the blood and to keep it moving more freely. So include lots of garlics and onion in your diet. Now there's the story of nuts. Beautiful nuts. Nuts such as almonds, macadamias and Brazil nuts will improve your blood fats and cholesterol. Brazil nuts have become quite famous in terms of its benefits on your cholesterol, and honestly, just a couple of days is more than sufficient to get those benefits. So it's an easy way to help your heart health along. Then we've got globe artichoke, and this has shown some really promising results in reducing the bad LDL cholesterol and also another bad blood fat, the triglycerides. The most potent part, however, is actually the leaf and not the heart in terms of its benefits on your heart health. Then we've got the bergamot orange. Now there's an Australian, actually a Sydney cardiologist who's actually done a fair bit of research on this. He's produced a product containing bergamot orange to help his patients. But the bergamot orange research has shown some wonderful effects on the blood fats. It's shown to activate a special metabolic switch that breaks down sugars and fats. It improves the circulation through the very small blood vessels, again through the inhibition of a special chemical. It converts small LDL to large LDL and small HDL to large HDL, but basically it makes those fats a lot safer. It protects you against fatty liver disease, which is a growing problem in our community. It blocks cholesterol absorption in the gut, similar to some of those phytosterols that you might find in some margarines and things. So bergamot orange is a real winner when it comes to improving a lot of different things for our heart health. Then we have baked beans, or actually just legumes. Now we all know the rhyme, baked beans are good for the heart. The rest of the rhyme, I'll actually address that in a minute. But there is a really good scientific evidence to back up the benefits of legumes of all kinds. So, what are the legumes? And here's a list for you. Black beans come out on top, but you've got butter beans, cannellini, chickpeas, kidney beans, peas, soybeans, red lentils, just to name a few. But I will say black beans do tend to just take the edge in terms of their benefits, but any of them, if you just have to pick one, you're going to get some benefits. They're all pretty great. They're full of protein, fibre, folate, potassium, zinc, iron, and a whole host of antioxidants. And they are naturally low in fat, of course, salt, and they have no cholesterol. Now, for those of you who are very time poor, these nutritious benefits are still all there in the tinned versions of these beans. So you don't have to go through the process of soaking and pressure cooking them if you're time poor. You can add them to so many different dishes. You can use them in soups and stews and pasta sauces, salads, and even make a dip from them. So, what are some of the benefits? It is as good as or better than cutting calories for slimming down. It's great for weight loss. Definitely helps to improve the health of our gut, despite what you think they might do to them. It helps to lower the blood pressure. It helps to regulate sugar and insulin levels. It decreases the level of bad fats, and not only does it reduce the risk of heart disease, but also stroke, diabetes, cancer and depression. Who would have thought the humble baked bean could do so much for us? Okay, the rest of that rhyme, the bit that ends it, I won't repeat that in a public venue, but nonetheless. It is a constant concern that people have whenever I talk to them about including beans and lentils in their diet. It causes wind. And it is due to the fermentation of undigested sugars in the colon, which actually acts as a wonderful prebiotic to the colon, so you're actually giving it a great benefit. You're feeding all your good bacteria, you're improving your colon health. Nonetheless, we have to be practical. So here are some scientific tips for you. The leading cause of excess wind in our diet is actually dairy. So the first tip is to reduce or remove the dairy from your diet, and it's particularly because as we get older we can't digest lactose as well. So have a look to see if that might actually be more helpful than removing the lentils or beans. Now the research also shows that if you have beans in your diet daily, most individuals will not have any symptoms, and the ones that did, by the second or third week, about 70% of those individuals reported a significant decrease in the wind. So the second tip is to have them on a daily basis. The third tip is to stick to lentils, split peas, tofu or canned beans, as they are less wind producing. And finally, adding garlic actually lessens the gas producing effect. So there's a few tips for you. If you're really keen to get into those legumes, which I thoroughly encourage, there's a few tips to help with the wind side of things. Now let's look at magnesium. Magnesium is a mineral that is front and centre in cardiovascular health, and it's deeply involved in blood pressure, blood fat, blood sugar regulation, and very easy to get from that whole food plant-based diet. So it includes all your leafy greens, your legumes, and your whole grains. Now let's talk about omega-3. Now omega-3 fats have multiple benefits on the cardiovascular system and elsewhere as well, but we do know that it decreases blood pressure, it lowers the blood fats and triglycerides, it helps to keep the blood thin and prevents blood clots, it reduces the risk of developing heart arrhythmias or abnormal heart rhythms, and healthy plant sources include flax or linseed, walnuts and chia seeds, for example. So, on that note, let's talk about fish oil. So before we move on to other aspects, I really need to address this aspect. Taking all of the best studies that have been done on fish oil, oily fish in the diet, and collating all of that data, here is the outcome. There is no protective effects on the heart for heart attacks, absolutely none. It doesn't protect us against sudden cardiac death, stroke, and it does not prevent deaths from heart disease or any other causes. So although omega-3 fats are good to include in your diet, more for the benefits for the brain, they are certainly good plant sources. You don't have to resort to fish oil. They just don't meet with scientific standards here in terms of its benefits. So use the plant-based omega-3, so your flax and linseeds and your walnuts and soy as well. Again, another way to help prevent any issues with your heart and of course reverse heart disease, consider the no alcohol, no caffeine advice, and there are a number of benefits to this. So caffeine itself does have some negative effects on the cardiovascular system. It's made worse obviously the more you have. It will raise your blood pressure and cause palpitations and extra heartbeats. It makes the blood vessels constrict in the body, heart and brain, and it can also make the blood vessels stiffer. It is linked to higher levels of cholesterol. It increases your risk of having a heart attack, particularly if you have diabetes. So staying off caffeine will definitely give you those improvements that you need. Now the cardiovascular system is deeply affected by alcohol. Even at the time of drinking, immediately, both the heart rate and the blood pressure will go up. In the long term, this will lead to ongoing high blood pressure and increased heart rate, and even a weakening of the heart muscle itself, and also irregular heart rhythms. So alcohol will also raise the levels of bad fats in your blood, particularly the triglycerides. So by taking alcohol out of the diet, you will have further cardiovascular benefits by reducing your stroke and heart attack risk. Now many people will say, oh, but there's antioxidants found particularly in red wine that provide some benefits. By the way, those studies have now been completely debunked, but by having a healthy plant-based diet, you're going to get a much better and safer source of antioxidants. If you're really keen to get those antioxidants they're talking about in red wine, you can get that from dark grapes or even blueberries. So a much safer way to do that. But in summary, taking those two out of your lifestyle, you'll have better blood pressure control, better cholesterol levels, and decreased risk of heart attack. Now, as part of that program that Dr. Ornish did with his patients, stress management was vitally important. Again, as I always say, it's a whole talk in itself, but here's some basic summary of some strategies you can include. Prayer and meditation, putting, your trust in God's word, and that will help to calm your mind. Take time out when you need it to recover from the stresses in life. Think positive. Develop an attitude of gratitude. Share your load with someone you can trust so you don't have to bear your burdens alone. Foster that spirit of forgiveness. Eat a healthy diet, which we just talked about. Get some regular physical activities, which we will talk about. And make sure you have a regular sleep routine and enjoy some good quality sleep. And always have some really good, strong social connections with family and friends. All of those things are very important. So, speaking of exercise, one of the key factors in preventing, treating and reversing heart disease, it was an essential part of that program that we spoke about. Now, globally and particularly in Western cultures, there is an increasing trend towards more energy-dense foods and reducing physical activities, and this is leading to lots of different serious health consequences. So, how will exercise help your heart health? Well, it improves your blood fats, it reduces your blood pressure, it improves your blood sugars, it will improve the blood flow through your heart muscle, it does help to prevent blood clots and abnormal heart rhythms, and overall, exercise reduces your risk of cardiovascular disease by 30%. Even if you did nothing else, that alone would produce that benefit. They did a meta-analysis where they collated a whole lot of studies and they looked at nearly 340,000 people. It found that exercise is as good as medication in preventing coronary artery disease and pre-diabetes. I know which one I would prefer. Exercise, tablet, exercise, tablet. Not difficult to choose for most of us. Alright, exercise tips for you. How much do you need? It's the same formula over and over again. 30 minutes a day, 6 days per week. So 3 to 5 hours per week seems to be the best window. If you exercise moderately more than 150 minutes per week, research tells us you will decrease your risk of heart attack by 55%. So remember, these are just talking about exercise alone without the other added benefits. So try to always include about 2/3 of that as really good cardio, so huff and puff kind, and about 1/3 as resistance training, where you're doing small weights, for example. Now, exercise is probably one of the hardest lifestyle measures to maintain and even start. So here's some tips. Do it with a family member, a friend, or in a group. This is actually really good for the social aspect and obviously makes it more enjoyable, and also you're more accountable. If you're not wanting to get up one morning but your friend will, you're more likely to go. Always choose more than one type of exercise if you can. I find this particularly helps with weight loss as well as the boredom factor that can occur. And set realistic goals. If you're really unfit, then start with low impact and gentle exercise and gradually increase that. Now, are there some wonderful herbs for the heart? Absolutely. I'll share a few of those with you. There's the hawthorn berry. This has a very, very long tradition as a really good heart tonic, so to speak. So it has some properties though that we know that can help in a number of areas. So what do we know? It can enhance the blood flow through the coronary blood vessels. It can improve the contraction of the heart muscle. It actually helps to protect the heart muscle from damage. It actually helps with abnormal heart rhythms. It lowers blood pressure and reduces cholesterol. So I will say, do take care, because it has some of these benefits. It may interact with some of those heart medications if you're on them. So it doesn't mean you can't take it, but if you do, let your GP know so that they can monitor those things. And the dose is 1 to 3 grams each day. Then there's the hibiscus or rosella tea, and it's made of the dried calices of the flower. It's a great herb for heart health. It's been particularly useful in terms of blood pressure, and it's as effective as some of the leading blood pressure medications that we use. I did actually take this for a little while because I was using it for antioxidant benefit, but I had to stop because my blood pressure dropped too much. So, as a bonus, it can help with weight loss, and the dose is 1 to 3 grams each day. Then we've got ginkgo biloba. Now, this herb has lots of circulatory benefits. It helps to improve the blood flow in the heart blood vessels, particularly and potentially in other blood vessels as well. We do know that it's quite effective in the brain circulation. That's where most people use it. That's quite good for the heart as well. Here you actually use tablet-based extracts rather than the whole herb, and just follow the dose guidance on the product that you purchase. Now, the olive leaf. Now, what we do know about this one is it may be able to help lower your blood pressure. It also can help reduce blood fats. A very simple dosing there again is 1 to 3 grams of the dried leaves daily. So here's my final healthy heart prescription for you. Always include God in your health plan, and just like David, ask God to create a clean heart and renew a right spirit within you. Adopt that whole food, plant-based diet, which provides the best dietary mix to not only prevent, but also reverse your heart disease. Make sure you include plenty of garlic and legumes and leafy greens, and a small handful of nuts such as walnuts, Brazil nuts, macadamias on a daily basis. Always avoid the harmful effects of caffeine, alcohol and smoking by removing these from your lifestyle habits. Manage your stress, always important in any chronic disease management and prevention. Make sure you get your half an hour a day of regular exercise. And finally, you might like to try some of those helpful herbs such as hibiscus and hawthorn berry. Thank you.